The pearl I want to share with you is about line angles, right? So when we're placing restorations, let's say composite restorations direct, and we're wanting to create those perfect line angles anteriorly, how do we do it? Well, you might have seen the trick where we can use a pencil to draw the line angles. Now I'm going to show you two different ways to apply the pencil. And because I'm in the studio and not the practice, I don't have a pencil. So instead of a pencil, I'll be using in this video an eyeliner. It's my wife's eyeliner. The funny thing is, I don't even know if this is eyeliner or not. I'm just assuming it is. So maybe the ladies can correct me, but I think this is eyeliner. It's Maybelline. Maybe it's Maybelline. Anyway, I'm getting distracted. She'll never know because she doesn't listen to the podcast. Anyway, so I'm going to use it in two different ways. So if you're watching the podcast, then great, you're going to get to see it. If you're listening, I can describe it in a way that's useful. If you want to draw where your line angles want to be, so if you want to draw where you would like for the line angles to be, you should draw it with the tip of the pencil like you'd normally use a pencil, right? So you draw it in, left and right, exactly, mesial, distal, exactly where you would like the line angles. So then you can use your Softlex disc or burrs or whatever you like to use to recreate exactly what you've drawn, right? Now, if you want to see or assess where the line angles currently are, so you know whether to push them in or bring them out, it's a different way of doing it. So you have to hold the pencil, or the eyeliner in my case, on its side. And if you hold it on its side and you just brush against the tooth, the height of contour of the tooth, i.e. the part of the tooth that sticks out the most, which is the line angle, will pick up the pencil. So if you want to assess where the line angle currently is, you use the pencil on its side. If you want to draw where you'd like your line angle to be, you use it normally. So that's a little tip on how to use the pencil. Now, how can we use it clinically in the best way? Obviously, you won't be using my wife's eyeliner clinically. The best bet you have clinically is using those clicky lead pencils. So click, 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 because the beautiful thing about that is once you've used it and it's been in the patient's mouth, you just break away the lead and then you click, 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 and there's no contamination there. And of course, you can use one of those light cure covers, plastic sleeves when you're using it. So this is like the most infection control friendly way of using it. So I hope you found that pearl useful, and thank you again to MSM Mini Smile Makeover for sponsoring this podcast episode. Now right over to Dr. Hassan Meghera on a very clinical episode, part 2 of the implant series. This is all about assessing your patients for implants. We even go all the way in depth from the start. We start basic all the way to talking about ridge preservation. So follow along and I'll catch you in the outro. Okay, Hassan.